Yep, we'll go through it. Are we ready, Mark? Okay, we're live now. So this is the policy committee for SSD, and I wanted to let Dr. Cuneo, and who's usually here, is Dr. Asner, about having Kevin Andert. He's going to be the lead on the all of the policies from now on for this year, and then Dr. Macklin and Wendy Pendergrass are going to be supporting on different ones, different policies that we're going to see that are effective in each one of their areas. One of the big things that I want you, the board, to know is that when we're looking at all these policies, we're trying to match up where MSBA is, making recommendations. So Kevin will walk us through it. He's got that nice PowerPoint to kind of let us, what the committee know, and then we'll go into the different policies that we're reviewing for today. Okay. Also, I'll turn it over to Kevin.
Wait, what does everybody see on their screen?
Right here.
Right now we see your board docs.
Okay, so when I'm taking notes, you can see that?
Yep.
Okay.
All right.
All right, great. Thanks, Amy. Yeah, Dr. Cuneo, as you saw ahead of time. So this presentation was just kind of walking through kind of a little bit of the change in philosophy of how we view handling board policy. I always think it's important to think about, why does policy matter? Because really, first and foremost, policy is what sets our standards for quality in the district. It's saying that this is where we're putting the bar. Also helps set direction for where we're headed. And it's an opportunity for us to embrace the district mission, vision, and core values, making sure that all of those pieces are interwoven through all of the policies that we have guiding the district. Policies also that way that we ensure compliance with all the outside groups that we have to comply with. So federal government, state, local, other regulatory agencies. And it's an opportunity for us to engage stakeholders in meaningful dialogue about key district priorities. This policy is a really good time for conversations to surface that might not surface otherwise during the day-to-day execution of business as a district. So you go and jump to the next one, Amy. Yep, so general changes. So as you saw, we're going to be establishing a review calendar for the year for policies and regulations. And so I've put together a draft, and I've shared that with Amy. And it's based upon really 4 big pieces. So recommendations that we get from MSBA, recommendations from district council, policies or regulations that are more than 5 years old. And this year, really most of what we'll be looking at are things that are more than 10 years old. There were a lot of policies that it's been a while since they've been reviewed. And then any other internal or external factors that might be impacting policy. That might be a change in programming, that might be changing in staffing, that might be changing in feedback that we're receiving. And so wanting to clarify pieces. And so those things might bubble up as well as we work our way through the year. When I put this together, my initial hope was that we would do no more than 6 policies per committee, because my thought was 6 policies plus an additional 6 potential regulations. So a regulation for each of those policies puts you at about 12 documents, which is a lot to review. However, in looking at the number of MSBA recommendations that we have yet implemented, there's a lot that we still haven't touched from the last year and a half, as well as a lot of the policies that are more than 10 years old. Probably going to need to increase that number closer to probably 8 or 9 policies that we'd be looking at, just to make sure that we get to everything that we really need to get to this school year. Every policy that we review is going to have a cover sheet. So you have that example over there on the right. So I think you got a chance to see some of those, Dr. Cuneo, as we submitted the ones this week. So that's the plan moving forward, is that every policy or regulation that's coming to the board, it's going to have this kind of quick overview summary sheet to give you an idea of why is it we're looking at it, who does this impact, who have we talked to, or who's providing input on this, and then how does this connect to other district initiatives, and then a brief summary of the changes, especially for some of the longer board policies and regulations. We think that summary piece will be really helpful.
I have a question. How often
Absolutely.
have outside of SSD family members ever made a comment on a policy to change?
So that's something we've been talking about. Amy, you want to take that?
I can't think of any. That's why.
Because my sound's off. Can you hear me?
Yeah, we can hear you.
So, Dr. Cuneo, honestly, as long as I've been in this role, we've never had a parent comment other than the PAC.
Yeah, the only time, Amy, that I ever remember is the time when we reviewed the policy on transportation, on whether we could take an SSD student, pardon me, a student with
Oh, yeah, yeah.
with SSD and a sibling on the same bus. And other than that, I can't ever remember any parent ever coming up with any information or any type of feedback. It would be great if we did,
Yep, and that's
But-
our goal.
but I can't remember, other than that one time, I can't remember any.
Yeah, so especially for these policies that do touch families, when we get into things like everything in I, so things in instruction, we get into J, using the PAC as a sounding board, especially that PAC executive committee, but actively seeking that parent voice is something that's a loop that we want to close, because they absolutely have skin in the game when it comes to what we spell out in our policy. And some of it's not even necessarily changing it, but how do we better clarify what the district expectation is so families understand what we're doing. And then our goal is to provide all this documentation to the board at least 1 week in advance prior to the meeting. So that way Amy can get it on board docs a week ahead of time. So, and give you plenty of time to be able to review whatever policies we're talking about. So thinking about stakeholder impact, stakeholder input in the process. So everybody on the screen are those stakeholders that we really want to make sure we're getting feedback from. Oftentimes we think a lot about that group in the upper right. We think about getting feedback from administration, and we think about getting feedback from the Board of Education through this committee and through board business meetings, but it's also families, staff, all of the different collective bargaining groups that we work with, the different advisory groups that we have in the district, as we have policies that are applicable to teachers or paras or related services. It makes sense to engage them in a dialogue about the upcoming policies or changes that we might be making. And then also community. And I've talked with Jennifer Henry, our executive director of communications, about how we can put board policies out there on district social media, and then having families use that Let's Talk feature as a way to provide us feedback. So even if they aren't a family or someone else that's physically connected to the district, we're putting it out there so that anybody can provide us feedback on our policies that we're looking at. So really engaging that broader community as opposed to just looking at who are the normal people that we go ask about feedback on policy.
Mr. Ander makes an excellent point there. I mean, when we talk about, one of the items are really the guiding principles under policy guidelines and operating practices in the equity framework really speaks to are the groups most affected by the policy consulted in the early stages of policy development. And so Mr. Anderson is right on point with those key pieces and talking about who's the inclusion piece as it relates to policy.
So
yeah, we don't want them finding out after we've implemented.
Let's go back to, not back to your other statement, but your other comment about how we would give a listing of 6, and you're saying now probably 8 policies every other week. Is there, and then what may very well happen is that we probably have 1 or 2 thrown in during that period, because we've got something that's specific on that policy that we need to deal with. All right.
Yeah.
On that, is there a way to notify, besides the policy committee and besides the board, what we're doing? I mean, we're live streaming. Is there, I'd be curious how many people are on the live stream.
Yeah, and it's the live stream and also the people that watch it afterwards. You do have people that watch the recording. So that's the other appeal of having these meetings recorded. But in talking with Jennifer Henry, we were also talking about how do we use our staff newsletter as a way to get this information out to employees? How do we use other newsletters? We have family newsletters that we have. How do we, for those policies and things that touch those different groups, many of them we have channels to communicate with those audiences. We just haven't been using them to communicate about policy. So incorporating these pieces as they are relevant into those already existing ways that we communicate with the groups on the screen.
Would there be a way in the newsletter that goes out, once a month? Roughly?
There's a couple of newsletters. We have a weekly newsletter that goes to the staff, and then we have a once a month newsletter that is more of a general overview piece of it. We also do board briefs. So we do update when after the business meeting, We do update what was decided upon, and it does reflect like what policies were adopted. That's on our website, and that's also socialized on Facebook, and we tweet that out too, so that people do see that there's a board brief section that goes out in our weekly newsletter, but also goes out in the monthly one.
In the monthly newsletter, would it be possible to give the policies we're going to be looking at the next month? So people would, that way, if they were interested, or if they even wanted to look at it afterwards, or they wanted to make a comment, they could get into it.
Yeah, we'll look at that piece of it. And just to clarify, Dr. Cuneo, we'll be sending you Kevin will be sending the 6 to 9 policies once a month. So it's not every other week, it's just one time a month.
Okay.
And
Yep.
Dr. Cuneo, one other thing I wanted to add was, I do send an email out after the first reading and after the second reading to those collective bargaining units and to our administrators to help get the word out that way too. And we ask for comments.
I was just saying if they would be notified ahead of time.
Yeah.
What was going to be done. I find people
Yeah.
usually don't do anything unless it affects them personally. But if they knew that ahead of time it was going to affect them or specific to them, they'd have a better shot to come up with some type of comments.
Sure. And now that we've built a calendar, so it's just about finalized at this point of where we're headed, it would make it easier to communicate out ahead of time that we've got a pretty good handle about what we're going to be talking about when.
Okay. Sounds good. Thank you.
Yep. And so then communications to the full board, this is just kind of a clarification. So policies in general will do 2 readings, but when we have those emergency policies, there is the option to do 1 reading, which one of the policies we're looking at today, GBBDE, that one, the VESA policy is in response to a change in state law that goes into effect in October. So probably that one we would benefit from approving after 1 reading as opposed to 2 readings. Just so that we have our policy in effect when the law goes into effect. And then
Those policies, can we, since that would be deemed an emergency policy, Amy, could we make sure in the minutes that we state this is an emergency policy and
Yeah.
the rationale for it, just so that we have a clean
Record of it.
record of all this?
Mhm.
Okay, thank you.
Yep, it's a really good idea. And then regulations. So they used to go to the board as an info item, then they kind of stopped a little while ago. So we were talking, and we really want to bring back the practice of having all regulations go to the board just as an information item. So it's kind of going with the policy together, not something that needs to be voted on, but just that way everything is going to the full board to help keep everybody in the loop. So anything, questions about that?
No, thank you.
Yeah, absolutely.
Which
All right, so
policy do you wish to look at first?
do we want to start with GBBDE, since that was the one that Dr. Asner had some feedback on? And I think Dr. Cuneo, you said you had some feedback on as well.
And it's the first one.
And first one on the list.
All righty. First of all, I want to say that I agree with Dr. Asner. If someone from their family is a victim of sexual abuse or assault and they end up taking 2 weeks of leave before deciding to terminate their employment, I don't think we should ask them to reimburse.
So are you thinking we should go ahead and then just strike everything? So in the paragraph above accommodation, where it says during an approved leave under this policy, the district will maintain an employee's health benefits as if the employee continues to be actively employed. We just cut off everything after that.
Correct.
Yep. All right. We can strike that through.
Okay. And on first paragraph, first page,
Mm-hmm.
under leave, okay? Explain what you're saying in that first sentence. I've read that a couple times. I'm not quite sure I understand that one.
Yep. So an employee can take up to 2 weeks of this leave, 2 work weeks during a 12-month period. And it's measured, the 12-month period is measured backwards from when the leave is requested to begin. So let's say that you took the leave on September 1st,
Okay,
then you would count backwards from September 1st for 12 months and see, is there any days that you've used it prior to that? Which if you haven't, then you'd have that full 2 weeks. But let's say there was a period in March where you also took a week of this leave, then you'd only have 5 days beginning that next week, that September 1st onward.
okay,
So it's just it's kind of like FMLA, where FMLA wants to take that backwards look of, at the time that you're requesting this, how much of this type of leave have you already used in the last calendar year? And then it resets month to month.
all right. The only other thing I had was that Dr. Asner had we had the same thing. I would ask him not to ask
Mhm.
for the reimbursement.
Yeah, and we had that language in there just because that was what was in statute. And so that's where that language came from, that statute left that door open. But we can absolutely be more forgiving than what's in Missouri Revised Statute.
Dr. Keenan, are you in agreement with that?
Yep, I am. I think it's in alignment with where we're approaching most of our leaves. We're keeping it within the spirit of this, but we're also trying to make sure that our employees are not being put in harm based on some of the policies that we're putting into place. So
All right,
definitely aligns with where we're continuing to move.
thank you. Okay, then next one you want to go with is,
Was there any feedback on the regulation, or were we fine with the regulation?
that's fine with that.
Okay. And we already have the form for this policy ready to go. So that way, when it goes into effect, if somebody's seeking to access it, HR has the form and is ready to process.
Amy, could you put, when this goes out on board docs to everybody, could you just put a notice that this is an emergency policy because by law, we got to have this thing ready to go by October?
Yeah, October 27th is when we need to have it on the books.
That way, they will know why it's an emergency.
Sure. All right, got it.
Got it.
All right.
Oh, I'm sorry. We are moving on.
Mhm.
Did we need to talk about GBLBR references?
Yes. We talked about this one before.
Yes, sir.
Mhm.
Yes, sir. It just, we added it, we vetted it through the proper channels, and we added the descriptor to number 5, just to clarify that a little bit. So that is the regulation, and that is what can be said.
This policy, though, does not deal with any member of the board. I was just wondering.
It's an employee, a former
Yeah.
Yeah, this is just employee.
employees.
And the reason why I bring that up is that I have been asked at different times to write a letter of recommendation for somebody at SSD. And so this does not cover this, that I would not be affected at all by this. Is that correct?
Correct. And I do not believe we have a policy under B, which would be everything that's tied back to board members that speaks to references. So that's something I would need to follow up on.
There's nothing. And the times when that usually occurs is that people have been asked to write recommendations for somebody who's applying for the board, who is on the board.
Mhm.
And I did not see anything. I know I wrote one for Jan Goodwin, and I also wrote one for Joan. And I never saw anything in the policies that mentioned it one way or another. I'm not saying that we should.
Yeah.
But I just wanted to make sure that I was correct in thinking that there's
Yeah.
no reference to board members ever on any of this.
Yeah, no, currently there's nothing out there. And if there would be, it would be in section B. And there's a couple policies that we could look at this year where you could add that in potentially where it might make sense. If that's something you want to clarify.
As long as it's not there, I don't see a reason to make more confusion.
Sounds good.
Okay, tuition reimbursement.
Mhm.
This is the one where there was some confusion over different members being allowed to have tuition reimbursement.
Yeah, so this one was a pretty simple change. The issue that we were encountering was we had support staff who already have a bachelor's degree seeking to take graduate level coursework. So let's say somebody was in accounting and they wanted to take graduate level coursework for an MBA. The way it was written before, they couldn't do that because we would only reimburse them at the undergraduate level, not the graduate level, where now this opens the door for someone who's considered support staff to take either undergraduate or graduate level coursework. It's also likely if somebody is in a support staff position, let's say they want to bridge over to a teaching position, they might be wanting to take a graduate level teacher certification program as opposed to an undergraduate level teacher certification program. And this keeps that door open as well.
This makes perfect sense.
And again, you know, for me taking a look at this through my lens, a question that I always ask, and it's actually in the framework, is are policies evenly distributed among all staff, right? And so this definitely answers the question of yes.
Yeah, this one makes perfect sense. Why did we do that before?
I think it was just an oversight that when this policy was put into place, we didn't think about all the scenarios where
Okay.
a support staff person would be seeking to take graduate level coursework. That we were thinking it from the lens of, well, everybody is going to be working towards a bachelor's degree. It's like, what if they already have a bachelor's degree or they're in a position classified as support staff where really graduate coursework is the next logical step for them. So I think it was just an oversight.
Okay. I was just wondering if there was any reason why we did it that way.
Undergraduate's
But I guess
cheaper.
Yeah,
That's about it.
okay.
All right. So for GCBAR, that one, we weren't proposing any changes, just we were updating the policy. So the policy's going, Amy, it's going for second reading now. Is that right?
Right. There's nothing in this. Yeah.
Yeah, so we were making no changes. We just wanted to make sure that the regulation date would then match the policy date as opposed to having the regulation be dated prior to the revised policy. So that's the only reason we're taking it here is so now that the regulation date can match the policy.
All right.
All right, and then JECR, that's the one Wendy was working on.
Yes, so this is just brought back to clarify the language. We kind of wordsmithed it a little bit, and then also I've already made the changes, although graduation is exciting. It is supposed to be exiting. So thank you, Dr. Ashner, for that. That has been changed.
I have a question on page 3 of 4. And I should have brought this up before, but I did not. Under homeless status,
Mhm,
Yes, sir.
mhm.
the district will continue efforts to obtain immunization information after enrollment. Do we have a timeline on that, when it should be done?
Go ahead, Kevin.
Yeah, sure. So with immunization requirements for a homeless student, there really isn't a set clock for that. And every one of those situations is going to be different. In some cases, it's us trying to work with the previous districts where that student may have been enrolled to get paperwork. In other cases, it might be trying to work with healthcare providers. In some cases, there might be little to no documentation for that student out there. So the timetable is going to vary from situation to situation. So we didn't want to pin us into a corner of, well, it's going to have to be this set time frame, especially if it's a student who might be from out of state or even potentially a student from outside the country that's now enrolling in our programming. Think about Afghan refugees who were relocating to St. Louis, or in the late 90s when we had Bosnian refugees relocating. Trying to get immunization records for those individuals was quite challenging. And some of those students would fall into that homeless category. And so by not setting a time frame, it keeps the door open to adjust based off circumstance. We might communicate a time frame to the family that we want it in 2 weeks or 3 weeks or 4 weeks, but those are soft deadlines, not hard deadlines.
I would just feel more comfortable. I would say something like, the district will continue efforts to obtain immunization information from enrollment, and monthly updates will be documented.
Yeah.
Otherwise it gets, continue efforts doesn't give me, doesn't spell things out. But if I have a monthly update that I've heard that an attempt was made, at least I know something was done.
And Dr. Kuno, you're not suggesting that the time frame was a month. Are you suggesting that there's an update?
There's an update on it.
Update.
In other words, somebody tried it every month.
Yep.
What happens, I find, is if you try to get a record and you can't get a record, everybody's got tons of stuff to do. I tried, okay. But if there's if ding on that, it makes at least that you tried it every month. So and if something would ever happen, I can go back and say, look, I tried.
Here's our good faith effort. Yep. Yeah. So if we had the language read, the status updates of these records will be maintained at least monthly until the student is in compliance.
That's great.
Okay.
And also, it's just an immunization right now. It's such a hot topic.
Yeah. True story.
I don't want to cause us any additional difficulties, but at least even if we had a form that said we tried, here's who we contacted, nothing happened. Okay, next month we got a form, we tried, nothing happened.
Yeah, and it's quite possible that we'll get it in partial records, that this healthcare provider might have had some of the student record, but not all.
Right.
So it'll be an ongoing process for some of these students in transition.
I would just hate to have somebody come in who was not immunized, and all of a sudden they were homeless and they're with us 2 months and they have measles. They have something that we may have other people who have not been immunized because of their own medical conditions that they couldn't, and then we end up with difficulties. This way I know that I have a record that we've tried. That's all I had on that policy.
I think that's it.
Well, that was pleasant.
Yeah. And if you want, I can kind of tell you where we're headed next, of what we're going to be looking at next month, if you'd like.
Yeah, could we share the calendar?
Yeah.
Oh, I don't have it on my laptop. I have it here in paper.
Yeah, Amy, if you could, Amy, if you want to make me a co-host, I could pull it up on my screen if that would help.
Sure. Thanks, Kevin.
Yeah, no problem.
While we're doing that, has anyone heard from Curtis today?
Curtis emailed me.
Oh, who can see this transcript? Not me.
Yeah, so. Amy, were you able to click the little 3 dots on my picture to make me a co-host? Is it letting you do that?
Okay. What am I doing here? Okay.
When I click on screen share, it still says disabled participant screen sharing.
Mark's coming in.
Okay. Sounds good.
Tech support's here.
Yeah, experts are good.
Yeah.
Kevin, hold on. The X side is because-
From now on, we'll make you co-host, Kevin. How about
Sounds
that?
good. That's good.
Oh, we're still on there. Our picture's still on there.
Yep.
There we go.
And if it's not doing that, I can drop the link in.
Yeah, just
It-
my participant box is blank. So it's not
Weird.
letting you click on your name or.
Yeah, okay, no problem. So what I'll do is I'm gonna drop the link in. And then Amy, you can just, if you click on it, then in a browser, we'll be able to pull it up there.
So he's gonna put it in the chat.
Oh, well, let's see if we can get to the chat.
So if you click on that, Amy, it should open up for you, and then you could share your screen.
Go over in the chat. Showing right
The
here.
chat's blank right now too. Okay, I'm gonna leave the meeting and I'll log back in.
Well, but if you're the host and you leave, I think it'll end the meeting, won't it?
Everybody will be ending. Yep. So,
Yep, so let me just read off
Okay.
kind of where we're headed next month, and we'll just go from there, and then we'll share it out.
well, I was just gonna say, if everybody clicks on it on their own computer, you can click on the chat and it'll show the document. So Kevin,
Yeah.
it won't be on the screen, but you'll see it in the document.
Yeah, and let me
Click
change
that.
settings real quick so Dr. Cuneo can see it. All right, so that should work. Yeah, Dr. Cuneo, if you click on that link, you should be able to see the calendar now.
Okay.
And so in October, we're looking at a couple policies in A. We're looking at AC, which is prohibition against discrimination, and AH, which is tobacco use. Then we're getting in DK, which is payment procedures.
Okay.
And then a couple in I. So we're going back to the conversation about virtual instruction and MOCAP and programs for homeless students. And then under B, board member removal from office is the 5-year review for that. And then you can kind of see throughout kind of where we're headed to after that.
All righty.
Right. Was that able to open up for you, Dr. Cuneo?
Yes.
Yep.
Thank you.
Yep. So we'll continue to update this kind of as things bubble up, and as we get more MSBA recommendations over the course of the year, we'll kind of work those in as well. And I am still working backwards a little bit over recommendations we received in the past of just making sure that nothing slipped through the cracks that we wanted to make sure we updated as well from previous MSBA recommendations.
Sounds good.
Yep. All right. Anything else?
No. Thank you, everybody. Have a good weekend.
Thank
Absolutely.
you, everybody.
Take care.
Have a good day.
Bye.
Now you can click it.
Bye.
And then
Then we have that up.
Strain is off.